Okay, now how many of you saw my newsletter, I think it was 2 months ago when Glenn Frey died? Okay, wasn't that excellent? Whatever. Now these are archived, so there's a button on my website that says Newsletter Archive. The article was called Goodbye to the Hotel California. So here's, our Glenn Frey, the eagle, our pop icon. He's suddenly dead at 67? 67, yeah. Okay, well, was way too young. And then the Virgin looked pregnant right from the start with the stories they were telling, right? What did he die of? He died of rheumatoid arthritis, ulcerative colitis, and pneumonia. I'm thinking right off the start, this isn't right. There's something rotten in Denmark here. How are these diseases related? First of all, I don't understand that. And I was very suspicious. And then I read the next article the next day, and it was quoting Irving Azoff, who was Frey's best friend and manager all those years, right? And he said that Glenn Frey died from medication, but he wouldn't, he wasn't allowed to cite the medication, or at least that article didn't quote it. And then I realized, now wait a minute, what medication for RA has the common side effect of ulcerative colitis and pneumonia? And then it hit me. Off-label, right? So one of the most popular chemotherapy drugs for cancer for the last 30 years has been methotrexate. I'm sure many of our parents have been prescribed that and taken it. But did you know that for the last 10 years, a very common off-label prescription of methotrexate has been for treatment of rheumatoid arthritis? So here's what off-label means. Off-label means using a drug for a diagnosis for which no testing has ever been done. Over 25% of pharmaceutical drugs are used in off-label applications today, according to the FDA, over 25%. So, it's very common for people with RA to be prescribed methotrexate. Now, when you go to the PDR and look up methotrexate and you look up all the side effects, all the other effects, of course, lung toxicities are right at the top of the list. Ulcerative stomatitis, malignant lymphomas, abdominal distress, all of these. Because if you have a DNA inhibiting poison drug like methotrexate, what tissues is it going to attack the first? Those most rapidly dividing: epithelium, alveoli, lung tissue, generative organs, and the epithelium lining the digestive tract. The most rapidly dividing tissues are the most susceptible to metaplasia. Now, to finish up the Glenn Frey story, a year later, I was talking to a chiropractor from Topanga Canyon who's good friends with Glenn Frey's wife and Glenn Frey, and she told me that the family came to the same conclusion, that Glenn had received treatment below the standards of care, and then a couple of months later, the family filed a malpractice suit against Cedars-Sinai for wrongful death. Okay, now I also have this pretty long chapter. It's called To the Cancer Patient. And I did a study of the holistic approach to cancer and the history of chemotherapy for the last 100 years. And this is in a chapter on my website. Here's the mechanism of action of methotrexate. According to the PDR, right? It interferes with DNA synthesis, repair, and cellular replication. Well, that would be nice if we could direct that to the cancerous tumor. Unfortunately, we can't. It's happened in general to the whole body. Most susceptible are the most rapidly dividing tissues. The mechanism in RA, so in other words, here's what it says. This is incredible. The mechanism of how methotrexate is supposed to work in RA is not established, but it may affect immune function. You think? Okay, so that's right out of the PDR. And that's your note number 52.
Methotrexate is a derivative of mustard gas, which was used as a biotoxin weapon in both World War I and World War II. It's some kind of isomer or biochemical derivative of mustard gas. That's where it came from. Don't really have to write all this down. This is in my chapter number 52, To the Cancer Patient. Okay, so off-label diagnosis for chemo since 2000, right? Here are some of the diagnoses that chemotherapy is used for today. Endometriosis, which is really a blanket description, sort of a generic, I don't really know what's wrong with you, and you're a woman, you must have endometriosis, right? So try this cancer drug, you know. And infertility, oh yeah, you can't conceive a child. Let's give you the most toxic substance known to man. That is certain to make you fertile and able to bear human children. Benign prostate hypertrophy. They are giving chemotherapy for BPH now. Pneumonitis, you know, that's one of the things that Glenn Frey died of. It's a side effect of the drug. Vasculitis, lupus. All these are diagnoses for which chemotherapy is being prescribed as an off-label use every single day. Dermatomyositis. And this is, did I make this up? No, this is your note number 61. Actually, this is an article on the CDC's website. Your note number 61. People are so saturated with the idea that disease must be fought to a finish that they are not satisfied with conservative treatment. Conservative treatment. Something must be done even if they pay for it with their lives. So I have a little dog, Caprice. She's half Chihuahua and half Dachshund, right? So 2 weeks ago I was like, I was picking her up, I was holding her, and she decided to jump out of my arms. So she jumped out of my arms and slammed into the ground and rammed her shoulder against the ground and screaming bloody murder for 5 minutes nonstop. So, you know, everybody's going, oh, you know, take her to the vet, take her to the vet. Now, I got to tell you, in California, Dr. Fred, I have not a lot of respect. I have less respect for vets, the things I've seen them do down there, and to horses and dogs, you know, than medical doctors. So, you know, I'm a chiropractor. I'm a conservative treatment guy. I'm a holistic. No, let's see what she does. Let's see what her body does. So, of course, she's walking like this for like a week, keeping the weight off there. So, of course, it's inflamed. I x-rayed her myself. I took her to my friend with digital x-ray, and I sat down on the floor, and I held her for 8 shots. We did 8 shots, and it was digital. I'll show you them. They came out freaking beautiful. No cortical disruption whatsoever. I saw everything in those views, including my fingers, right? And the medulla was perfect. The joint was articulated well, too. It wasn't even dislocated. So it was just a really, really bad sprain, right? And so really bad sprains, the body takes care of those. And so it took her 2 weeks, and after 2 weeks, I see her out. Now she's starting to dig, and now she's climbing the stairs, and now she's like 99% better. That's conservative treatment. Oh, actually, I forgot to tell you. After 10 days, I would stretch it out, and then finally I was able to adjust it. It moved really well. But I mean, that is so alien to the way that most people think. They're going, oh, something might be wrong, you know, take her to the vet, you know. I can't imagine what the drugs that the vet would have done, the procedures that he would have done. We had this instinct. The instinct has been bred out of us by propaganda and by TV and by media not to trust the wisdom of the body. That's the first thing we should trust. The first thing we should trust. Rely on the wisdom of the body. And then if that's not working out, then do we try something more drastic. This willingness to die on the altar of medicine is one reason why no fundamental improvement is made in medical science. Now, he wrote that, that's Tilden. Tilden wrote that 100 years ago. Have we evolved beyond that erroneous way of thinking 100 years later? No, we're worse. We're worse now. We trust the wisdom of the body less today than we did 100 years ago.